It is 5 o'clock, and I'd like to call the Health and Human Services Board together at June 18th here at 5 p.m. in room 1400 of the St. Croix County Government Center. Roll call, please.
Sean Anderson.
Present.
Mike Barkalow.
Present.
Dr. Finley is excused. Kathy Leaf.
Present.
Lisa Lind.
Present.
Deb Lindeman.
Present.
Dave Osnes is excused. Julie Smith.
Present.
Greg Telejohn.
Present. Thank you for everyone for being here. Minutes were in the packet. Is there any changes or corrections or any comments on the agenda or the minutes from last meeting? Hearing none, they'll stand approved as presented. There is public comment. This is not the comment for budget discussion, but this is public comment on any other subject. Anybody here for public comment? Public comment. Any public comment? Hearing none, we'll move on to the first business item. This is open public participation process of review of letters and take public testimony related to the 2026 Health and Human Services budget. First person I have here is Erica Primo. How do you pronounce that? You'll have to tell me.
Primo? Yes.
Good evening. My name is Erica Primo, and I am the Director of Community-Based Services at Northwest Passage. I'm pleased to be here this evening along with Aaron Long, who is the Program Coordinator for Northwest Passage Transitions, the adult family home that's located in New Richmond. Tonight, we're going to be sharing some exciting updates on our expanding service offerings in St. Croix County and also an update on the adult family home. So we'll be sharing some of our current partnerships and opportunities for further partnerships. As you may know, Northwest Passage has been around for over 45 years, primarily serving children and families with significant mental health concerns in our residential treatment setting at our Frederick and Webster locations, along with serving adults in our adult family home here in New Richmond. Over the last several years, we have all witnessed the need for mental health services grow drastically without enough clinicians in our area in Western Wisconsin to meet the need. As an organization, we have felt called to fill those gaps and expand our services to provide a continuum of care through both residential treatment, assessment programs, and community-based outpatient services. This has led to exciting developments. We've been actively developing and enhancing our outpatient service offerings. As part of this effort, we're proud to announce that we will be opening a new outpatient mental health clinic in New Richmond in the coming months, right here in your own backyard. We will be providing outpatient mental health services and wellness services, including individual, family, and group therapy, psychoeducation services, along with our neuropsychological evaluations in an outpatient setting. We are always growing our offerings to best serve our communities. Not only will we be providing these services in our clinic, but we are also a CCS provider contracted with St. Croix County, and we also do direct contracting with counties in order to meet with clients in the community and school districts. It's important to note that our services are different than most mental health practitioners. We provide an innovative approach to our mental health services. Our experiential passageway framework emphasizes the connection between mental health, nature, creativity, and physical well-being. When these elements work together, we have seen firsthand that hope is restored and our clients are able to create a lasting therapeutic lifestyle to build resilience amongst their life's challenges. As you look around this building here, you will see what we call the passageway in action through our nature photography on the walls that has been taken by our clients. This is just one unique way that we incorporate the passageway elements into our healing process and serve the residents of St. Croix County. We have long-standing ties here, and we're eager to build upon this strong foundation and expand the high-quality mental health services that we provide to St. Croix County residents. We know that when individuals and families thrive, communities thrive. We will continue to provide these updates on the progress of our outpatient mental health clinic opening and the referral process and the further opportunity for collaboration. Thank you all for your time and continued partnership. Aaron, who's the program coordinator for Northwest Passage Transitions, the adult family home, is going to provide an update on the current program that started back in 2012.
Hi. I'm Aaron Long, Program Coordinator for Transitions. It's a pleasure that I can address you all with an update on our partnership with Transitions and Northwest Passage. We began this journey together in 2012 when our licensed adult family home began providing a short-term residential option for service recipients in St. Croix County's emergency services and community support programs. Our intent was to partner with these programs to increase continuity of care, provide reimbursement to St. Croix County for services provided by serving on your teams, and limit costly inpatient hospitalizations by providing a less restrictive option as intervention within the community. Over the years, we've worked closely with the county to expand our services in unique and innovative ways to best meet the needs of the county and its residents. Most recently, we've been providing peer support through the ARPA dollars. Our staff have worked to meet the needs of the adults we serve in real time, day to day, offering support to work through stressors, leading to a reduction in costly hospitalizations and inpatient stays. This is corroborated by the many individuals that have made significant gains in their mental health as we have supported them in working towards their recovery goals and assisting them in living a therapeutic lifestyle. As the years have progressed, we have continued to display our commitment to supporting St. Croix County Health and Human Services. The addition of the community-based services Erica mentioned will enhance that partnership within the county as well, and will provide more opportunity for collaboration. As you enter the budgeting process for the next year, we look forward to continuing your Transitions partnership by providing the highest quality care to the residents here in the county. I'd like to thank you all, and if there was any questions, please don't hesitate to reach out.
Thank you. Next person I have is John Gostovich.
Good evening, I'm John Gostovich. I submitted some written comments earlier, and I just wanted to urge you to do everything you can do to enhance the services that you provide. Everything that the county does is important, but we are living through a period of time when elderly people, children, vulnerable people, mostly people who are disabled or poor, are facing very real threats to their well-being, their quality of life, their ability to have a decent and good life in America. And thinking back to when Senator Shafholt and Representative Zimmerman spoke at the Chamber of Commerce, they both said that they felt they had a responsibility as members of the Joint Finance Committee to pay attention to funding cuts coming out of Washington that would harm their constituents. And I trust that all of you has phoned those gentlemen, reminded them of the care they expressed for vulnerable people in St. Croix County, and urged them to do what they can as they put together finally the budget for the state of Minnesota, take care of poor people, disabled people, elderly people, and children. They need to hear from you because they said they were concerned about this and that they felt a responsibility to our most vulnerable citizens. These are our brothers and sisters, these are our neighbors, and they're under, well, I just, thank my lucky stars that I'm not one of them today. It's gonna be horrible. Beyond that, I trust that you have talked to your representatives in Washington and urged them not to transfer hundreds of billions of dollars from people in America with modest incomes to probably the 250 wealthiest families in the land. This is reprehensible. These folks have so much money, they can't spend it now. And to make this kind of transfer while other men and women go hungry, work 3 jobs, are scared to leave their homes is, well, I don't generally use this kind of language when I talk to a government body, but this is immoral. This is not okay. And none of us will, when our children and grandchildren asked us what we did, And we said, well, it was one of those things. We didn't do a thing. That's not okay. So please, I support your programs. I'd love to pay more taxes to help vulnerable people in St. Croix County. And I hope that you all do the difficult and almost unthinkable thing of looking at raising levies in our county so that people have enough to eat, so that people have health care, so that people have mental health. Because I think this is where the buck stops. And if nobody else is gonna do the right thing, then you have an opportunity to step and do it. I'm upset about what's going on in America. And I'm upset about the people who are suffering needlessly. And I'm encouraged that you all take what you do as seriously as you do, that you look at innovation, that you look at controlling costs, that you look at helping as many people with the services you provide as you can. And the needs are going to be growing, unfortunately. So if there's anything I can do to help you guys, I will do it. And if there's anything that you can do to help the people who are crying for help in our county, I hope you step up to the plate and do it. Thank you.
Thank you. Next, I have Celeste Coburn.
Good evening. My name is Celeste Coburn. I live in the town of Hudson in St. Croix County. I'm here to say that all of the services and programs that the St. Croix County Health and Human Services Department provides are essential to all of us here in St. Croix County. The needs are great, and the needs are going to continue to grow. They're not going to decline. When you're looking at your budget for 2026, don't cut Health and Human Services Department. You probably, I'm sure you do, need to actually look at increasing funding for the Health and Human Services Department, because the needs are going to go up given what Congress is proposing regarding funding. They're not going to go down. And when it gets down to where the services actually get delivered, the county does it. So I urge you individually and as a body to exert some pressure upstream, which is to tell members of Congress that the big ugly bill is not okay, that it's not okay to take from the poor to give to the rich. It's not okay to cut more than $1 trillion in federal funding in order to give more than $5 trillion in tax breaks to people who are among the wealthiest in the world. I also urge you individually and as a body to contact Senator Staffschultz, Representative Zimmerman. They both represent portions of St. Croix County. They both sit on the Joint Finance Committee, and they are writing that budget right now. And frankly, in that position, they have great power. It's not too late. They should be contacted. They should hear from you. Because if the feds cut back, then the states are in the position of having to backfill some funding. Our state has a surplus. Our state can look at also, instead of giving more tax cuts to those who are at the top, maybe make our tax system fairer, which means raising taxes at the top. And tough as it is, and I know that a majority of the board doesn't want to do this, you're going to have to probably raise the levies next year. Because it's not acceptable to try and balance your budgets at the expense of the people who are the poorest and the most vulnerable and the most needy. Thank you.
Thank you. Next, I have Lori Harmon.
I'm going to have to move this down. There we go. My name is Lori Harmon. I've lived in St. Croix County and town of Hudson and Hudson for, I don't know, 35 years, something like that. I was a school teacher. I taught English at Hudson High School for almost 25 years, and I had, that's an alarm, not a phone call, sorry. Thank you. All right, that means I gotta talk fast. Um, I wasn't planning necessarily on talking today, but I'm very concerned as the speakers who have just spoken are, with the state of the funding that is possibly being cut. As a school teacher for over 25, almost 25 years in Hudson, I saw firsthand that despite the fact that we are all doing very well, many of us in St. Croix County, there are a lot of people who are not. There are students who live in their cars, there are families who have to use places to take a shower because they don't have a home to live in. There are children who maybe don't get enough good nutrition at home. I have seen firsthand foster children who have needed some really specific care, and all of those things are part of who we are as St. Croix County. Again, I haven't planned what I was going to say, but I just know that being on a board like this, you guys have a tremendous power, but you also have tremendous responsibility. And I don't envy your jobs because you have some really tough decisions to make. And I appreciate that you're serving your time here. And I really, really hope sincerely that you will communicate to Staff Schultz and to Zimmerman and to all the other congressmen and representatives and senators in the state of Wisconsin, but also in the country, that we really need to protect our people. Our people are what makes us great, and our people need to continue to be supported. It's easy to look around and see that we're doing okay in St. Croix County. We're like the second richest, I think, in the state, something crazy like that. That doesn't mean people still don't have needs. Head Start, Medicare, Medicaid, SNAP, they're all important programs for the people who live here. And my guess is every single one of you has met someone or knows someone or even is related to someone who has benefited from those programs. So I urge you to keep those people in mind, keep the many people in St. Croix County in mind when you're looking at the budget and you're considering the things that have to be done to keep things going. Thank you for your time.
Thank you. I think that is all. Anybody else trying to speak in public comment? Otherwise, Colleen, she has several to read into the record.
Good evening. These were all letters or emails that were submitted to me as I was the contact for this meeting. So I'll just kind of read through them. This one is actually from Jennifer Jones, who is here, so if we end up having questions, she's more than willing to come forward. So on behalf of Family Resource Center, St. Croix Valley, I would like to thank the St. Croix Health and Human Services Board and Director Bob Barrett for the opportunity to share how the services we provide positively impact at-risk children and families in St. Croix County. We value our longstanding collaboration with St. Croix County and the strong working relationships we've built with the many dedicated team members across the department. She shared that they've been around since 1998, and the mission has been to strengthen children and families and communities through education. They are a nonprofit organization funded through contracts, donations, and grants. They serve Pierce, Polk, and St. Croix counties with their central office in Baldwin. We offer a continuum of support and parent education services for both universal and high-need populations. Our programming includes personal visits, parent-child group connections, developmental screenings, and a robust referral network. We implement evidence-based and evidence-informed programs, including Parents as Teachers, Triple P, Positive Parenting Program, ECE, FAST, Early Childhood Education, Families and Schools Together, Recovering Together Cafes, and Period of Purple Crying. Our 10 full-time parent educators all hold bachelor's degrees in human development and family studies, social work, or child education. Why early childhood matters? If done right, high-quality, parent-focused early childhood development programs that begin at birth can make an extraordinary difference in outcomes for both the child and society. When we talk about high-quality programs, we mean home visits, we mean parent education, as well as child education. Our parent educators help families create a home environment that increases parent knowledge of child development and improved parenting practices, support early identification of developmental delays and health concerns, help prevent child abuse and neglect, strengthen school readiness and long-term success for children. Their impact in St. Croix County, I believe this is up to 2024, 67 families were enrolled in home visiting, which included 193 caregivers and children, 875 home visits completed, 644 individuals participated in group connections across 3 counties service area. Group offerings include Baby and Me, Play and Learn, Triple P seminars, ECE Fast, Recovering Together cafes, and 5 for families. 548 families of newborns received welcome baby visits across 4 partner hospitals, and 363 individuals participated in special events such as brush strokes art event, flex gymnastics, dads and daughters, Hudson G&G, farm-based events at Threshing Table, White Pine Berry Farm, Jensen Pumpkin Patch, Leeson Family Farm, and Young Acres Apple Orchard. Spanish-speaking prenatal classes as well. We continue to offer training for community partners on the 5 protective factors that strengthen families. 1, helping kids understand feelings, social and emotional. 2, parenting as children grow, knowledge of parenting and child development. 3, connecting with others, social connections. 4, building inner strength, which parental resilience. And 5, knowing how to find help, concrete supports. We thank you for your early support of the 2023 initiative to train community partners, parent partners, and staff members in offering Recovering Together cafes, which have expanded to serve families in recovery by building peer support and reducing isolation. A continued partnership on behalf of the leadership team and entire staff at Family Resources Center, thank you for your ongoing financial support and partnership. We are proud to serve alongside you on the front lines, working with families and shaping the environment that influence our youngest community members. We respectfully ask for your continued support as we strengthen families with young children. Please don't hesitate to reach out with any questions. Jennifer Jones. So do you have any questions for Jennifer? Okay, the next one is from Chief Gordon Young from the River Falls Police Office. Dear members of the Health and Human Services Board, on behalf of the River Falls Police Department, I am writing to express my strong support for the continued funding of mental health crisis services in the upcoming fiscal year. These services and the vital partnerships they foster between behavioral health professionals and local law enforcement are indispensable to the safety and well-being of our community. In recent years, our officers have increasingly encountered situations involving individuals in the midst of mental health crisis. These moments often require not only compassion and patience, but also a level of clinical expertise that goes beyond the traditional role of law enforcement. Thanks to our partnership with St. Croix County's Mental Health Crisis Services, we have access to trained professionals who can provide immediate support, assessment, and care in these complex situations. The crisis response team and associated services have proven invaluable in diverting individuals from emergency rooms and jail settings that often are ill-equipped to provide the help needed and into appropriate treatment and support systems. Maintaining and enhancing this partnership is critical. Continued funding will allow these services to expand their reach, respond more swiftly, and support both residents and first responders more effectively. As a law enforcement leader, I am deeply appreciative of this collaborative model and firmly believe it represents a best practice for public safety and public health alike. I urge Health and Human Services Board to prioritize funding for mental health crisis services in the upcoming budget and to recognize the profound positive impact this investment has on the lives of individuals and families in St. Croix County. Thank you for your commitment to building a safer, healthier community. Please feel free to reach out if I can provide additional perspective or support. Sincerely, Gordon Young, Chief of Police, River Falls Department. This is from a community member, Mary McGurran, submitted an email. I'm unable to attend the meeting, but would like to express my support for maintaining the current service levels, including the programs which focus on criminal justice diversion and treating and supporting community members with mental health and substance use disorder needs that face loss of federal funding. Our community members also have needs for prevention of child and adult maltreatment and response for safety when maltreatment occurs. Additionally, transportation for older adults and adults with disabilities have access gaps based on county location. The ADRC is a valuable resource that helps connect people to resources to keep them living in the community independently as possible. Additionally, there is a need for focus on support and education in our community on disease prevention and how vaccines support the health of our children and communities. Thank you and your team for the work that is being done to support the health and well-being of our community. Sincerely, Mary McGurran, Hudson. And this last one is from Scotty Ard, who is the Director of Permanent Supportive Housing with the Salvation Army in Grace Place. She was hoping she could be here tonight, but conflict. I'm Scotty Ard. The Permanent Supportive Housing Program, PSH, works exclusively with chronically homeless individuals and families who have a member or members who have been diagnosed with behavioral health conditions. The persons we serve are amongst the most critical and have fallen in every crack of our system. Today, as you consider the needs and wants of the Health and Human Services budget, I ask that you focus in the areas of service which present the greatest challenges. 1, behavioral health, including alcohol and drug abuse, are on the rise. Children and youth are included in the rising data. Undiagnosed and untreated individuals are far more costly than the cost of treatment and case management. The need for easily accessible services, timely assessments, clinical therapy, rehab of at least 90 days, peer counselors, case management, and medication management has never been greater. 2, the number of vulnerable adults who are homeless or at risk of homelessness is rising. 2 of 5 persons coming into shelter are 60 or older with physical or cognitive conditions. The need for additional resources in outreach, adult protection, case management, supportive housing, food security, and medical care must be a priority. 3, HHS and the judicial system have significant crossover. Working to resolve barriers resolves many future issues such as decreased income, evictions, depression, and anxiety due to the individual in jail for not attending a probation meeting due to no transportation. During COVID, probation appointments were done on Zoom. Today, their appointments are all in person. For those who do not have access to transportation, the risk of violating far outweighs the risk of driving while revoked, getting a ride from a negative influence, or giving up to hopelessness. We are facing unprecedented economic and social uncertainty, which in and of itself is a catalyst for behavioral health conditions. Funding the challenges I have shared, developing cooperation to ensure a client's success will be time and money well spent. Scotty Ard, Salvation Army, Grace Place. That's all I believe I have.
Thank you, Colleen. Anybody else that we missed? Hearing no others, that will close the public participation of Health and Human Services budget hearing. Next item on the agenda is financial report from May.
So I'm Faye Strenke, Fiscal Manager for Health and Human Services, and I have the financials through May of 2025. Okay. So just wanted to bring up, so our 2024 numbers, as I've mentioned before, we're still finalizing those. Right now, we're showing a negative 137. We are expecting some additional children's long-term support funds. That reconciliation was just finished. So that should be in the budget or in that column by next month. We are finishing up the audit, so we will have additional audit entries too that will affect the 2024 numbers. For public health, just one of the things I wanted to mention, we are keeping an eye on some of our grants. We have some COVID grants that were still, the end dates had been extended. One of them ends June, another ends December. There's kind of been conflicting information, ended early, reinstated again. So we are just keeping an eye on those and then applying expenses to those grants as they're available. And then our regular immunization budget too. I know there's been some talk about changes to that. So we are working, our public health officer is keeping an eye on them and staying informed and letting us know what to expect with those. Otherwise, we are pretty much on track of where we were at the same time last year. Behavioral health, I just did want to touch on our purchase services. As you can see, those are significantly above where they were last year at the same time. And those are between Winnebago and Trempealeau placements that we have. So that's having an impact on those purchase services charges. CCS, our revenue at this time for May of 2025 is lower than it was in May of last year. And that's changes in our services. We've had a lot of people graduating from CCS. Some of them, it is, they have to have Medicaid in order to be in this program. So as that unwinding occurred, if people lost their medical assistance and they were no longer eligible for this program. So we did see a decrease in that, but when you look down here at our purchase services, you'll see that same level of decrease in the purchase services. A lot of those, the service facilitation is provided in-house, but a lot of the other services are contracted with outside providers. Economic support, you'll see we had a big jump in our human services grant, and that's just the timing of payments that came in. January and February's payment came in May this year instead of June. Children's services, and there our purchase services is down this year compared to last year. That was primarily youth justice, child protection, and then in our CLTS. Children's long-term support transition this year and had some updates of things that we were previously able to bill for on behalf of other providers, and now those are no longer eligible to be done. So we've had some reduction in the purchase services through children's long-term support. And then again, with the level of placements and out-of-home, they've been working to reduce those. One area that you can't see in here that increased was our birth to 3. So again, we've had a large number of enrollments in birth to 3. There is no wait list for that, so we do contract out our occupational therapy and physical therapy for that. We have 2 in-house speech therapists, but that line item itself is actually higher, and we'll probably go over budget because of the increased needs in that area. ADRC, just a couple comments for there. We did have the marketing grant, so you'll see our other our state revenue again seems higher than last year. Part of that was the $25,000 marketing grant that we had not budgeted for and came in extra. And then also because we had the 2 extra positions in ADRC, so that's drawing down our ADRC funds faster as we have more staff that are using that money. We do have match money that will help keep that going throughout the year. Let's see, where did I was just going to say our, outreach and education, that's at $27,000. There was part of that marketing grant, why that item is so high. Healthcare campus is doing well. Their revenue this year is up significantly, $534,000 over the same time frame last year, so the nursing home is doing well. They still are using some pool staff, but that's down quite a bit too from last year at the same time. Orchard View itself, when you look at that individually, has a negative balance. That's still that transfer to debt service, so it will kind of take them up to the end of the year to cover that. And next year we may distribute that differently depending on where that income is higher, if it's in the skilled nursing facility or Orchard View. It basically just goes against that healthcare campus fund. Doesn't have to go individually against either of the programs or departments. Any questions for me on the financials? Okay, thank you.
I was just going to make a comment on those purchase service costs for behavioral health, primarily related to Winnebago. There was action by the legislature that directed DHS to apply for a waiver that would allow for Medicaid reimbursement for people that were Medicaid eligible who went to Winnebago Hospital. That's the reason that we don't get Medicaid reimbursement for Winnebago is because it's considered an institution for mental disease, which is a CMS classification for a mental health facility with more than 16 beds. There's an exclusion in Medicaid law that prevents larger institutions from being billed or for receiving Medicaid payment. So the DHS was directed to apply for a waiver that would allow Medicaid reimbursement for people that went to IMD settings. I just wanted to mention that our hope was that waiver would eventually be approved and would allow for us to recover some of those Medicaid dollars from people that we place in Winnebago. It doesn't look as though that waiver will be approved, or as of now anyway, the outlook is pretty grim. So unfortunately, those purchase service costs may remain high in Winnebago unless something happens with that waiver. That was our hope, though, is that waiver would help to reduce those purchase service costs for Winnebago. Right now, we're responsible for covering those costs with the exception of a little bit of private insurance that we get reimbursed for.
What's holding up the waiver? Is it a legislative issue? What's the problem?
The message I got from DHS was rather vague. It was just around the change in the administration. Oftentimes delays these kinds of waiver requests, but the current climate around approval of these has been less favorable recently. But I wanted to explain the purchase service costs could have been impacted or could be impacted by this waiver should it get approved.
Thank you. Any other questions? Thank you for the report. Consideration of capital improvement projects for HHS departments. Who's handling that? Ken?
As you can clearly see from this chart. All right, not clearly. All right, so this is our entire capital plan. I'm only going to go over the highlighted rows, so I won't be talking for very long. So in Health and Human Services, we have 2 capital projects listed here. It's replacement of vehicles with ADRC. We have vehicles on a rotation, vans and buses, so you can see the cost difference on different years. And then we have residential lift for the healthcare campus. And so those are replaced on a rotating basis also so that they have new and functioning equipment. And that's all we have in the KIP for Health and Human Services.
Any questions?
Stay tuned for July. You can hear about the rest.
Thank you. Review of intoxicated driver program, IDP fee reduction. Who's got that?
That would be me, Shar Lopez. I am the Deputy Director of Health and Human Services. Where is it? Right here. All right, there it is. So this, if you look, this is just kind of a background on the intoxicated driver program. It's been around for a really long time. It's changed a lot over the years. Recent review of the IDP protocols and best practices indicated that we were actually providing too much service, and we were encouraged by the state to scale back. So what we did is that we're restructuring the program. We're not reducing how much per hour that we're charging. So to make it a little bit more user-friendly and consumer-friendly, we're taking off several of the charges, and we're wrapping it all into that one all IDP-related services for that $380 charge. Just as a comparison, I added our neighboring counties, what they charge, and then I also added some comparable size counties. They're all over the board. So we wanted to simplify as much as possible, at the same time trying to look to improve efficiencies for the consumer and for the staff. So we are going to be moving forward with this as of today. Faye and I have some figuring out to do with some of the middle of the ground things. So we'll be contacting folks who may have already prepaid some of those. And so we'll have to figure out, navigate that. So do you have any questions on that?
Do we have to approve the fee?
We're not changing the per hour, we're just restructuring, we're restructuring how we're doing it, so we're still being reimbursed for what we are doing. We just aren't charging all of the other fees with it, we're just wrapping it all into one. Instead of redoing, 12 different fees for people.
So the answer is?
You can. It doesn't hurt to approve it.
I
Whether she
move to
needs it or
approve the IDP cost adjustment.
Is there a second?
Second.
Okay. There's a motion and second. Any other discussion? Hearing none, all in favor say aye.
Aye.
Aye. Opposed? Motion passes.
Thank you.
Summary of Regional Crisis Services Summit for Western and Northern Wisconsin, May 23rd, 2025.
I'll let Shar speak to most of this. I just wanted to set the stage for why this summit was held to begin with. As you probably know, for the last several years, we've been interested in finding ways in which to better serve people in crisis from mental health and addiction more locally instead of having to refer them to Winnebago or some facility that's a long ways away and at a cost to us, but also at a cost to the person being transported a great distance during a mental health crisis. We attempted to apply for grant money for a withdrawal management center out of Kitty Roads. That we didn't get that grant, or we got a reduced version of it, which wasn't enough money. And then after that, Health Sisters Hospital System closed in Eau Claire, which created an even more urgent sort of need for these either residential or enhanced local resources to help assist people in mental health and addiction crisis without sending them to a hospital. So Tanya Eichelt, from my counterpart in Polk County, and one of her board members, I think it was her board chair, wanted to form a group of northern and western region counties to get together and develop some ideas for how we could develop a better crisis system, an enhanced crisis system in western Wisconsin that would help to assist people in crisis without requiring hospitalization. And this summit took place as a result of ideas that were developed in many discussions leading up to it around what's a realistic option without building a facility, without creating an urgent care kind of facility, without any sort of sustainable funding, which seemed like, well, it really is almost an impossibility. Without some sort of sustainable funding to create this and incentivize a provider to open one, there really isn't going to be something like that anytime soon. So we looked at what are the other options? What can we do to enhance what we're already doing or create some innovative strategies for how to manage this differently? And that's where the summit developed from. Legislators were invited, county human service directors, law enforcement, and a variety of others. So Shar was a big part of this and took part in the presentation at the summit, and I'll let her describe what was discussed and what the recommendations were that came from it.
Thank you. And just to note on that, these discussions had started probably a year ago with multi-county folks just looking at what are low-hanging fruit, what can we do without a lot of extra money. We explored our low-hanging fruit, and that was looking to see if Minnesota would be willing to open some of their beds to us. We were the only county that actually had a contract with United in Minnesota, and after discussions, they actually pulled out of our contract and decided not to contract with us at all. So that was really our the need for more beds instead of building them. Can we use others? And that kind of morphed into how can we get this conversation on a bigger scale. We actually had this summit on the Friday before Memorial Day, which was a risky day to do it, but it was very well attended. And we were in Rice Lake, and so it was pretty centralized. We represented the northern and northwestern Wisconsin, so there were 33 counties that were actually represented. Northwestern, we did most of the work on it. So I'm just going to give you a highlight of it. All of the PowerPoints are in there, and they were very well done. So a lot of them have some really great detail in them, but there's one visual that I want this to show you. This is the 33 counties that were all involved. They put them together in by size, and most of the counties that were listed are extra small or small, and they make up more than half of the total land of Wisconsin, but only a portion of the 22% of the population. And the other really, I think, notable visual is of these 33 counties, so Eau Claire has a hospital and La Crosse has a hospital, and they were also included. Their hospitals generally accept Eau Claire County and surrounding, and La Crosse County and surrounding. So that leaves 56 beds for the rest, the other 31 counties to grapple over. So when you see that visual, it gives it a whole different feel as to why our Winnebago bill is so high right now. So just kind of a few things that we talked about. We talked about mental health parity and how, and you all know this, Bob has talked about it in the past, that, while on paper it says that we're supposed to have the same coverage for mental health as physical health, but clearly we don't. When you get some of these really rural counties, they don't even have a hospital in their county, so their access to even physical health becomes very challenging. We talked about how the rural counties take brunt of the burden on many of these things, and the extra small, the ones in the more than northern areas really struggle to have any services at all. We did a breakdown on what it actually costs for one emergency detention, so one 72-hour hold. And these are the hospital charges that just if you have a private insurance, your insurance is picking it up. Not your first 72, we're picking it up. If you have private insurance, they may be paying parts. However, that's just the tip of the iceberg. When you're looking at a full commitment, you have court costs, you have attorneys and judges and court personnel and social workers, and then you have 2 psychiatrists, and you have transportation, and you have law enforcement, and it can be $30,000 or more for one commitment. No doubt there are folks that need this service, and what we were trying to really talk about is how a community response sometimes can elicit the same outcome if you have the time to spend with folks who are in crisis. We had actually a very compelling testimony from a person with lived experience, and she spoke from the heart on not only her experience, but her as a person with lived experience going through those crisis, and also from a helper part side where she is now working and trying to assist others in the community. Lots of conversation around how law enforcement is impacted, and we all know that. We've talked about that quite a bit. There was a couple law enforcement officers there. And one of the coolest things that happened is we had the ability to highlight our co-responder program. Adam Kostanek had worked with Sergeant Jeff Kennett and co-responder Nate Cundiff, and had created a video, a really great video. It's actually on our YouTube channel. It's like 6 minutes long. I won't play it now, but I encourage you to watch it. And really so with that, we were also, the Dunn County talked about their Project Hope, where they have a mental health law enforcement agency officer. And so really what our ask was is to take that $15 million that is still out there from trying to create creative interventions for crisis and focus on the 33 counties in northern and northwestern Wisconsin, and offering opportunities for additional co-responder programs that have that time to sit with people and come up with those community plans to avoid the placements in the hospitals if not necessary, recovery coaches and peer supports, and mental health officers. Do you want to talk about the letter?
Yeah.
Is it this one?
So as a result of that, Tanya Eichelt sent this letter to legislators proposing that funding be used towards co-responders and peer support specialists and mental health officers, proposing that 1 to 3 positions per county be created with an emphasis on the western and northern region counties. She has updated me just recently, I think yesterday, updated us that the Joint Finance Committee has looked at these proposals and will be putting forward a bill outlining some of these requests as a part of the budgeting process. So there is an opportunity there, I think, to at least enhance our co-responder model and enhance possibly peer support in our county. These kinds of services are relatively low cost. They have a huge impact in terms of preventing downstream high-cost services. And it's a way to help people stay in the community, stay in their homes, and receive support without being transported great distances in handcuffs a lot of times, and preventing law enforcement from having to commit so much time and resources to transporting people. So the hope is that this would be a relatively, I don't want to say quick fix, a relatively easy intervention to implement in this area of the state, shy of a physical urgent care facility with beds. And I don't think, I said this a number of times, I don't think more beds is always the answer. I think sometimes the engagement and the way that we work with people can be done more effectively to help prevent them from going to a hospital in the first place. Not always, but I think a majority of the time those kinds of interventions can be more effective and much more cost effective, certainly. So we're hoping this gets a little traction, and we'll see where it comes out if it makes it through the budgeting process.
This seems kind of related. Where's the state at with, they were putting together like guidelines or something for what a local, I guess, crisis facility looks like? Have they made any progress on that?
They've expedited rule language around what's they refer to as CUCOFs. They're Crisis Urgent Care and Observation Facilities. The legislature had directed DHS to design rule language around these kinds of facilities with the intention of making the western region of the state a priority for development of these. What they offered was, that is, what the legislature had to offer was several $1 million, probably this $15 million that was left over from HSHS closure, a return of some investments that the state had made there. The problem with that is, that I said earlier, is that even if say a county got $4 million to open and operate one of these, there was no way to sustain, there currently is no way to sustain that cost going forward. So that's what I'm saying. The idea is good, but unless they find a way to attach a Medicaid rate to that, or there's, you know, some miracle, some state funding attached to that going forward, no one's going to design and operate a facility like this that requires, you know, the staffing pattern itself would require $2 to $3 million a year just to pay the staffing costs, not including the facility, the food, the laundry, housekeeping, all that stuff. So there's a real cost to this up front. The cost savings is realized down the road when you stop having these high costs in Winnebago or something of that nature. So the rule language is coming out, Supervisor Anderson, soon probably, but it provides an outline for what would have to happen if you opened one, not any of the funding that goes with it.
So this past day and a half, a few of us, Supervisor Chalajon and Char and Bob, were in a strategic intercept, and Julie, mapping exercise that helps us understand the ways that people with substance and behavioral health issues intersect with community services and law enforcement. And one of the things that we are hearing, though, is the peer support and the behavioral health help that we have for law enforcement has really helped us to create safety plans, and that has really helped us reduce the number of emergency detentions. We heard it from Corp Counsel that was present in the Assistant Corp Counsel that was present in the meeting, and so I think this is a vital thing that we should be pushing to get through the budget, because we're seeing it help. As you said, Char, today, that these are the folks that accompany law enforcement. If it's safe, law enforcement leaves, they can spend the time needed with that person to work out what they may need. And it's not that law enforcement don't want to do that, they just don't have the bandwidth to do it. So this is this kind of care, which is upstream, and the effects sometimes take longer, but we're seeing it already. So this is great.
Any other comments?
I just have one more. It was great. It was such an honor to be able to highlight what we've been able to do here, and all of that was first available through the ARPA funds, and then now that they're permanent positions, being able to be leaders in that area. So that was actually really nice. There are some of our neighboring counties. Pierce right now has one, and they're looking to do very similar things.
Thank you very much. Next item on the agenda, overview of proposed Medicaid changes and potential impact.
All right, thank you, Mr. Chair. Sorry, I'm yelling at Colleen here to help me. So my intention with providing this to you was just to try and be transparent about what we think some of the changes under what's the official title of the bill is One Big Beautiful Bill, H.R. 1, what the impact of some of those changes could be on state and county health and human service programs. And I focus mostly on things that are in the news a lot, like work requirements and the FMAP, or the federal medical assistance percentage, if that were to change, and how that could impact states and counties. So that's primarily what I'll try and just give an overview of. To obtain this, I didn't read the 1,000-page bill. I'll be upfront with that. But I did look at the Congressional Budget Office summary for Medicaid impact, and that's the nonpartisan group that looks at the fiscal impact of any policy bills that the federal government puts forward and tries to analyze those to determine what the impact might be from them. So I looked at the Medicaid provisions under that aspect of the CBO summary, and I looked at other summaries from associations and DHS, the Department of Health Services at the state level. So just quickly, I won't spend a lot of time on this. I know Rhonda Brown from our Economic Support Division is going to dive in a little more to the SNAP benefits or food share benefits and how those could be impacted by some of these changes to potential changes to Medicaid and benefits. As we know, this bill passed the U.S. House and is now with the U.S. Senate, so there could be further changes with it. This is just meant to be sort of a playing the movie to the end kind of thing to see how these changes could roll downhill to counties and impact us. So looking at the work requirements, some of the changes in the federal bill would require work, would have work requirements for Medicaid beneficiaries beginning in 2027, and it would extend the age of eligibility, or the age that work requirements would apply to. So I think is it 50 now is the age? We don't have work requirements, but I think the age is 19 to 50 now, and this proposes extending that from age 19 to age 64. And on the surface, I understand this, on the surface, it sounds reasonable to say people should have to work if they're able-bodied and contribute, or volunteer, or do community service work. The reality is about 75% of people on Medicaid do currently work, this able-bodied population. The challenge with the bill, and where it could impact low-income folks, is that it adds an additional set of requirements for proving that you're working this set amount of hours or meeting the eligibility requirements in the bureaucracy of the eligibility process. Now, you might also say, well, that's just part of it. You have to do that. But when we think back on the populations we just talked about, like people with substance use disorders, people with mental health conditions, some of the statements read about people being homeless, food insecure, and some people have all of those things going on. They might be able-bodied and they might be in this age group, but unable to follow through with a lot of the requirements that would be asked if this bill were to pass as written. Those additional requirements are challenging for people who have a difficult time planning and thinking, reasoning and thinking logically because of the circumstances they're in, or because of their addiction and or mental health condition. So the idea is, when we look at this, and what the analysis showed was the expectation that a good number of people would drop off of Medicaid simply because they're not able to meet those eligibility requirements, those additional eligibility requirements, and the more frequent eligibility, what do you call it, check-ins, or I can't think of the terminology, but there's more frequently they'll have to show the criteria. That's one thing. The other thing has to do, that I was going to talk about briefly, has to do with the potential to reduce the federal medical assistance percentage. Now, just to frame this, the federal government currently in Wisconsin generally covers 60 cents on the dollar for Medicaid reimbursement. So if we have a Medicaid, we charge somebody $100, bill Medicaid, the federal government picks up $60 of that, and then either the state or the county picks up that remaining $40, that non-federal share. For Medicaid expansion states, which we're not, the federal government pays 90 cents on the dollar, up to 138% of poverty. So it covers a broader range of people, really what's been referred to as the working poor, oftentimes, who maybe have jobs but don't make enough money to afford health insurance and other health benefits. So those Medicaid expansion states and even Wisconsin could see that federal share drop to the minimum, which would be 50%. In other words, when we bill somebody for a $100 Medicaid bill, the feds would pay $50 instead of $60, and the state or the county would pick up the other half, which in a $100 scenario isn't much, but when you're talking about the Medicaid population and the impact to the states, that turns into billions of dollars quickly. So the concern there is that states would then be receiving less federal support for Medicaid and would therefore have to make decisions about what do we keep, what do we cut, where do we prioritize our Medicaid dollars that remain? And that then would trickle down to counties. After the states make these kinds of difficult decisions, it would come to counties, and we would be left with, here's what the state's willing to pay for, here's what we would have to pay for, and then the counties, of course, have to make those decisions locally about what do we do, right? So those are the kinds of implications that I wanted to focus on a little bit with this bill. It's not that people would be denied Medicaid so much as it would be people would drop off of it because of the additional work requirements and other eligibility requirements, and that the states would probably be left with less federal support for their Medicaid programs. Like I said, Rhonda is going to focus on SNAP benefits or food share benefits. There's other aspects to the federal bill that would impact public health, an elimination of chronic disease prevention and health promotion and other kinds of prevention work that would be either eliminated or drastically reduced. So we're watching all of that, right? And our idea, we don't know. We don't know how to conceptualize this yet because the bill hasn't even passed at the federal level, and once it does, then the states will have to take action. So we won't really know how the impact will come down to a county level yet. I think what we've talked about today speaks a little bit to what some of our strategies are, which is to look at these populations that could be impacted, like people with addictions and mental health disorders. If they drop off of Medicaid, then they're untreated in our communities and more likely to come in contact with law enforcement, right? More likely to end up in jails, more likely to end up in emergency departments. So that's why when I talk about our focus on not just the criminal justice involved people, but that's a priority population because we're likely to see more people end up in criminal justice situations if they're not being treated for their physical health and primarily behavioral health conditions. So we are placing an emphasis on that. We're a nimble department. We try to be responsive to the ever-changing needs of the community, to the ever-changing funding structures that we face. And I think we're a creative bunch. We're used to being creative with our funding in terms of how we use it and spend it. And I think the more money we can look at spending on these upstream solutions, the more we save in downstream crisis events, and that's our intention. So I don't know if, I put some additional information in the board packet around potential impacts to county government. Like I said, we don't know yet how this will play out, but I did think it was important to at least provide hopefully a little explanation about a thing might look okay on the surface, but when you dig down a little bit, you can see that the impact could be more widespread and more harmful maybe to lower income people who are not necessarily trying to do anything wrong. They're just not able to keep up with the increased eligibility requirements and more complex eligibility requirements, and by nature of that will drop off inadvertently. So Rhonda's way more knowledgeable and skilled at talking about this eligibility piece, so unless you have questions for me, I'll gladly turn it over to Rhonda.
It's concerning to me on several levels that, like you said, that it looks like it should be fine on the surface, but just because people drop off doesn't mean the need goes away. And we're going to be facing it in other ways that are going to be much more costly, and that's very unfortunate.
I do worry about the stress on the safety net. We're about the last line of defense for people that have nowhere else to go. So it's us, it's the shelter, it's law enforcement, and it worries me. It worries me a little bit that that could be stressed even further to the point where some people may not have have good options for what they do for their health. And they might wait until they get very sick before they go to an emergency department. And then that's uncompensated care for the hospital. And, you know, it snowballs, right? So that's my concern, is that the impact from this can maybe not be immediate, but it'll be an increasing stress and pressure on the safety net for the people that really have nowhere else to go. And that's what we focus on. Of course, our work is focused on that population. We want to lift people up so they can be productive, so they can join the workforce, so they can contribute to the county. We want to do that. And some people really are not in a position to lift themselves up without that kind of support. So, okay, that's enough.
Any other questions, comments on Medicaid? No. Next is a proposed SNAP food share changes in federal budget reconciliation bill.
Oh. So we'll move here. Hi, everybody. Sorry. Getting acclimated here. I have not presented in this format yet, so, but happy to be here this evening. I'll piggyback obviously on what Bob said in terms of some of the resources that I utilized to create a pretty high-level presentation on the food share portion of it. Again, from proposed changes in the federal budget reconciliation bill, which is presently with the Senate, as you know, and you know, from what I'm seeing at this point, I think there seems to be some agreement in terms of the proposed changes with maybe some slight modifications at this point, but as Bob said, we don't know until we know, essentially. I also made a couple of notes there just for context, just to say that food share and medical assistance, so for elderly, blind, and disabled Medicaid, Badger Care, the food share employment and training program, and caretaker supplement programs are all income maintenance programs, and I just wanted to mention that because income maintenance tends to be a term often used in statute or the budget. And then also to note that food share and Medicaid are entitlement programs, so there's no wait list on applications. You know, it's guaranteed benefits for anybody who meets the stringent eligibility requirements as defined in statute. And then also really just that our consortium is required to meet any program and service demands we have in that regard, regardless of funding or budget limits or what have you. So, and we're required to do it with some pretty strict performance standards as well. So, so outlining here, if passed, the proposed changes in the current budget under review will affect the food share eligibility for residents served by HHS and the Economic Support Division. As you know, we administer food share. We also administer medical assistance that Bob talked about. And presently, there are approximately 4,800 individuals in St. Croix County that receive food share specifically, although, as you know, we operate across county lines as a consortium for 10 counties. So Barron, Burnett, Chipwood, Douglas, Dunn, Eau Claire, Pierce, Polk, us, and Washburn. It would also reduce administrative revenue to counties for the income maintenance operations, which I just iterated to you. So the first proposed change is the age change for work requirements. So when Bob was talking about it for medical assistance, oh, sorry, thank you. There isn't presently a work requirement for medical assistance, so that's new in terms of that program. There is presently a work requirement for food share recipients, and the proposed budget proposes to change that policy, so to expand it, as Bob said. So increasing it up to the age of 64, and then also having parents with children 7 to 18 also be required to work or provide some exemption as to why they cannot work. So that is one of the areas I'm seeing maybe a potential slight modification. I've seen 10 proposed, 10 to 18, but again, we don't know until we know.
That would reduce the number of eligible individuals, but it also increases the IM consortium workload. So it would increase calls to us, educating consumers on work requirements, reviewing cases, which I think was the word, Bob, you were trying to think of earlier, processing proof of work, making referrals to the Food Share Employment and Training Program, which is a lot of program coordination back and forth, and other agencies as well. The second proposed change is the state match, and that is based on error rates. The states would be required to share in the food share benefit costs, which, mind you, I think in the 80 years or so that food share has been in existence, the federal government has covered the full benefit costs. So this, again, is a new item. An entirely new proposal. So Wisconsin currently has a low error rate, although we're learning some nuances of that as well. Error rates run on a federal fiscal year, and so 2024, if they were to look at that, our error rate was around 5%, a little bit under 5%. We're hearing that maybe they're would focus on 2025. Which we're somewhere around 7% as a state. So we're actually already in the danger zone, if you will, in terms of what the proposal states, which is concerning in and of itself. I just also wanted to state that Wisconsin is often set out by other states for guidance on how we maintain low error rates, both in terms of our case and procedural error rates and our active error rates. So I think that Wisconsin, we do a pretty good job really of trying to maintain that as is prior to anything coming up about eligibility or error rates in the budget. In the future, the error rate would also include all food share cases in the calculation, which is significant because presently smaller amounts are not included in the overall error rate. So again, we would not only have repercussions for a higher error rate, there would be more cases contributing to that error rate, so increasing it more quickly. If Wisconsin's error rate increases to 6%, which again, likely based on the new rules, and actually now that since I have prepared the presentation, we are already above that. If they look at 2025 numbers, we would fall into a higher cost share bracket. So not only assuming cost for benefits, but also assuming a higher cost than we would based on the present number in 2025, the error rate. So GPR costs from $68 million at 5% to $207 million at 15%. And I believe there was a handout that had that outlined in there, and if you want more detail on that, I can certainly provide that as well. Again, trying to keep it high level. The third proposed change is an administrative match, so reducing the food share administrative match rate from IM activities to 25 federal and 75 state local, from a 50% currently. So again, it shows you the numbers there on, it would be a significant loss for us in terms of administrative funding. It would also mean that food share would have the lowest federal administrative match really of any major entitlement program, including Medicaid, child welfare, and child support.
If I could jump in, Rhonda.
Yeah.
I think one thing that's important to note on all these things is that we know the federal government's going to change stuff. We don't know how the state's going to react to it. So this one's a really good example, I think, that, the match right now is 50-50, the state picks up the other 50%. So is the state going to say, okay, fine, we'll pick up 75? Or are they going to turn to the county and go, okay, now we need you to pick up 25 or 5 or 10 or whatever number that is? And that's where it's going to come down to, based upon what the federal government does and the state government, it's going to land on your laps for policy decisions on what we're going to do. So, again, we just don't know yet. But
Thank you. Yeah, I was going to say that I've heard some preliminary. Yeah, thank you, I appreciate it. I was going to say there have been I've heard some preliminary discussions about that in some state committees that I'm attending, but nothing formal certainly. So what Ken said. So I mean, ultimately, it's the proposed changes are kind of they're hitting us at administrative costs, they're hitting us at benefit costs, and they are also looking at policy process changes, eligibility requirements. So all really aspects of that in terms of how it would affect us. So, and as I said, some of this is, while it may reduce eligibility, it also may increase workload, which is always a challenge to balance. The more that we need to look at cases, the more that the individuals need to provide proof of things, that is interaction with our agency and call centers. So just something to consider, I think. And there's a cost to that, right? Some additional impacts to consider with reduced funding. We have contractual performance requirements that I had mentioned just briefly earlier, but we have expectations about call wait time, answer rates, application timeliness rates, error rates, overall customer experience, not only for food share, but it would impact any other program that we administer in our call centers as well, that I mentioned earlier. Less revenue for local economy, that's just a statistic that exists. It comes back to local communities. Food share comes back to supermarkets, grocery stores, convenience stores, et cetera, farmers markets, et cetera. Food insecurity brings residents to our lobbies. That puts added pressure on HHS reception staff. Colleen could speak to this. And subsequent resource referral agencies, so food pantries, schools, churches, et cetera. Again, that's a real thing that we, thank you, see. Good thing you have the handout. So we have people in our agency and on our call center that don't have food. We have people that come in that will not leave late on a Friday afternoon because they cannot feed their kids over the weekend. That is reality of the situation in many instances. And then lastly, food and nutrition are a necessity that helps maintain stable families. Again, I say this often, but these are life-sustaining services. It's prescriptions, healthcare that Bob talked about. This is food, it's basic needs stuff. Stability is a proponent of health and safety, and then instability can lead to indirect impacts to other county programs. And Bob already talked about that, so I won't go into that too much. But it puts pressures on families who have limited income as is. On the last page, I just wanted to put a few links for you, active links for you to look up information if you wanted to do that. These are big, complex programs. I could say so much more. There's a lot of information out there if you're interested in learning more about it. As I said, there was also a good summary handout on Medicaid and a summary handout on food share that are interesting just in terms of how many adults versus children, how many Medicaid individuals, Bob mentioned this earlier, are working families, working individuals, either full-time, part-time. There's some information about our food share program and what exemptions currently exist, if you're interested in knowing what that might look like. And I can provide any specific data for St. Croix County or our consortium or what have you as well in terms of performance or staffing, how we operate, and that type of thing. Any questions?
What's the average, I know it's different by every case, but what are the average monthly benefits that a family would get?
It is based on the
Number of children
individuals in
and
their
household?
family.
Okay.
Yeah.
And then I know I had a friend with lived experience being on this, and sometimes it's temporary. In a
Yes.
lot of cases, she was in college and had a child and needed the benefits. So I think there's some folks that think that's perpetual, but I think, do you have data on how long people are on SNAP? Is it oftentimes short or is it longer periods?
I don't have anything that I could say specifically, no, but you are correct. I mean, it is a temporary program for some, and then there's some who are elderly or disabled who may be on it longer term. It varies. We definitely see people come on it and go off it with employment, or maybe they're employed and they're promoted, or, I mean, we see all kinds of life scenarios, really.
Another question. So you're seeing the need, obviously, but then what is another worry is that the grants for some food shelves have been reduced or eliminated. So the pressure is even greater on what benefits they might be getting from you. And if they don't qualify for SNAP and they were depending on food pantries for their supplemental, that's drying up too, possibly.
Yeah, I
So
mean,
again, the need's not going away.
correct. Yeah, I think that's absolutely true. I mean, we're hearing that from other agencies who provide food supports for individuals, certainly. We also see June as a big food share application month for families who are going into summer when their kids aren't fed at school. I mean, again, there's so many nuances to it, really. You know, if you may have heard with childcare is a program that we also administer, which is also experiencing great challenges in terms of childcare costs for families, but also maintaining enough providers for families to be able to work and have childcare. And their cost means, you know, maybe not eating as much at daycare. I mean, it's all those things really that we kind of hear in terms of the families and the individuals that we work with. So complex needs, complex programs for sure. Thank you for the questions. I was just going to say, to sum up, the focus needs to be on the vulnerable populations that we're concerned about, with what Bob talked about with medical assistance and also with food share. I also just want to say that for our division and our consortium who administers these programs, the whole balance of changes and requirements and managing workload and performance expectations of all of those things are a very real thing for us too. And I would feel neglectful if I didn't say that. I think, you know, we always say we are adept at mobilizing and changing the tires while the car is going down the highway, and that is very true, and we are certainly doing that already, even though we don't know what we don't know. We keep saying that, but consortia are already kind of mobilizing statewide to figure out how we can reduce our error rate, which is something that anything that we might have some control over. I've mentioned before that we are, you know, our consortium, it has very strong leadership. We communicate often as leads and managers. We are positioned on several state committees. We meet regularly with DCF in terms of childcare, DHS in terms of medical assistance and food share. You know, we have one of our very own, our operational administrators, a tri-chair for ESPAC that reports to WICSA. So I want to put that out there that, you know, we are very efficient in what we do. We do it with a lot of integrity. We use a lot of technology. We're exploring technology more and more, including AI and some programs that are just implemented and that probably will be implemented. So it was important for me, I think, to say that, you know, we take all of this very seriously, and that was before these proposals, and it certainly will be as well. And if any of you have any questions about that, you know, let me know.
So I see the impact to St. Croix County in 2024 was $8.2 million for SNAP alone.
Correct.
Could I ask a question real quick? Rhonda, when you talk about error rates, can you describe what those may consist of, those error rates? And back to the proposal, the proposed budget, an error rate or an error would consist of anything like 50 cents would count the same as a $5,000 error in terms of how they calculate the error rate.
As to how they're
Both those
proposing
things?
it going forward, yes. The majority of errors really they're not fraud, so that's not what we're talking about. Generally, they're, I guess what you would refer to as accidental errors. They can be client errors, and they can be agency errors as well. Some of the things that we get marked on as an error are things outside of our control. So our correspondence, for example, that is system generated has to have certain language in it based on FNS or CMS guidance, and if it doesn't, we might get an error on that. Nothing we can do about that. So it's not fraud that we're talking about. It can be, you know, someone who has multiple part-time jobs and maybe fails to report a change in income or change in hours, maybe because they didn't understand they needed to do that or what have you. Yeah, it's those types of things. Is that what you were looking for? Does that help? It includes underpayments as well, yes. There can be underpayments as well. If there's agency errors, that can certainly happen. These, again, are complex programs for sure, and the programs that we administer align on some things and they don't on other things, so the system isn't always our friend in that regard. So yeah, I mean, but again, when we're looking at 5% or so error rate and 99+% timeliness across the board in terms of applications and renewals and anything else that we're processing, you know, we've exceeded performance expectations for a very long time, so. Question?
So I just have a quick question. Do you
Yeah.
do audits then, or how are you figuring out the error rate? How do these things come to light that?
Yeah, so the feds do audit, the state does audits, so that's what they're looking at in terms of our error rate. But we do a lot of quality control measures for our consortium, so we have several processes in place that we look at cases, things that we're finding. We have that information advise us in terms of coaching and training and all types of things. And again, some of that information could be a system enhancement that would really reduce or eliminate an error that we experience that we may report to DHS to fix. So we have a lot of different ways that we go about trying to be influencers in terms of making things as efficient, timely, accurate as possible. The new item, it's a pre-certification tool is what it's referred to, and it is something that definitely could use some improvements. I'll be honest about that, but it currently exists in our system, and so it's something that we're looking to do. So taking any time and energy that we are spending in quality control and moving it up the spectrum of impact to the front end, pre-certification, pre-confirmation, which is extremely challenging for us in terms of workload and managing timelines and managing all the other performance expectations that we have. But that is our hope, to try to impact that as quickly as possible. And so we're presently scrambling to get the proper access and all the things to make that happen.
Any other questions? Thank you very much.
Thank you.
Request for future agenda items. Any future agenda items from anybody? To be determined. Announcements. Any announcements?
Yes. Oh, I was on the whole time. All right. Yes, Mr. Chair, I have 4 quick announcements. We applied for a $100,000 opioid settlement match through Vital Strategies. It's a global public health organization that was offering a match for opioid settlement dollars that we've already received. And sent in an application a week ago or so for a $100,000 match to support our substance use professional embedded in our Child Protection Services division, working with families affected by parental substance use. So we'll find out about that in July if we get the match or not. There'll be some public health reporting that goes along with that and involvement in the treatment court for that position if we get the money. Our behavioral health and CCS divisions applied for an opioid abuse prevention grant of $241,000. It would impact work that we do with schools, law enforcement, Recovering Together cafes to help support them. I don't, the timeline for that would be October 1st through the end of September of 26. So it's a 1-year grant for $241,000. And we'll see if we get that. I'm not sure when the announcement comes out for that award, but soon, I'm thinking August maybe. I wanted to mention that Judge Waterman was appointed to the Family Treatment Court officially So he'll be the presiding judge in family treatment court with an expected start date of around the first of the year, 2026, for family treatment court to help support families affected by substance use again. And I know, Deb, you've asked about the community health assessment and community health improvement plan. That's under development. I talked to Ellie about that, our public health officer, and I think we could present on that in August, if that's something you'd like to get an update on. That's our public health division does a community health assessment and health improvement plan every 2 years, 3 years, 2 or 3 years. And they're finalizing some of the data that they've collected and some of the priorities from the community and partners that we work with. So I wanted to mention that that's coming, probably not until August. Thank you.
Any other announcements?
I would just like to say, just because Aaron is here, and he did mention that Northwest Transitions, the artwork that they give us, so I invite all of you. There's some of the artwork that's in our new look spot here is put up, but also then throughout the entire services center in New Richmond. We get compliments on it all the time, and so it's their client photography that they put on like canvas or a metal, and it's displayed in our building, and I just wanted to give a shout out to that because it's really does make our building look much more homey, so thanks.
Thank you. Date of our next meeting is scheduled for July 16th. With no other comments, we are adjourned.
I don't know why. I think it's because when I was at an event, which I don't think we could, but go through, like, what is your, lupus got an albuterol inhaler. What is her deal? Yeah, I'm sure I'm gonna go through any screening at the airport. What is going on with her? Yeah, I get the whole